Hello everyone. Today I'm going to talk on the subject of Polycystic Ovary Syndrome, also popularly known as PCOS. I chose this subject because it is quite a common condition, a condition which is overdiagnosed. Talking about PCOS, let's first deal with the definition. So we have 4 words in that Polycystic Ovary Syndrome. Poly, as most of you probably already know, poly is anything which is more than one, many, multi. So poly is a commonly used medical term for anything that has many numbers. And then cystic. Now cyst, it's very important to understand that all cysts are not dangerous, cancerous kind, because the first thing that comes to mind when anybody talks about the C word, people's minds immediately jump to cancer. A cyst, what is a cyst? A cyst is nothing but a sac with a membrane-like covering which is filled with fluid, air or other substances, and they can be of various sizes, and they can grow anywhere in the body, under the skin, in the lung, in the brain, and of course concerning today's topic, in the ovaries. Then we come ovary, of course, they are the part of the reproductive system of the woman. There are normally 2, one on either side of the uterus, along with the tubes. And then we have, and ovaries have a very complex function. They start functioning at the time puberty occurs in a young woman, which could be any time between 11 to 18, and stops. The ovarian function gradually starts dwindling, going down after 45, and then finally stops at a variable age between 50 to even up to 60. So that's the ovary. And then very important is the syndrome part of PCOS, Polycystic Ovary Syndrome. So a syndrome is different to a disease. A disease is a condition which has an identifiable cause, already established known cause, whereas a syndrome is a group of symptoms which occur consistently together, and they may not have an identifiable cause. Having said that, we have to remember that there are certain syndromes which did not have an identifiable cause, but over time causes were discovered, but they have continued to be called syndromes. Alright, so that is as far as the definition or the expansion of the Polycystic Ovary Syndrome goes. Polycystic Ovary Syndrome, according to American College of Endocrinology and other societies over the world which deal with endocrine problems, we have to realize that they are not, it's actually, PCOS is a very misleading term because it focuses only on the ovaries. It's only the ovaries having multiple cysts is the problem. But this is couldn't be further from the truth. This is just one aspect of PCOS. Alright? So according to most of the societies, we need at least 2 of 3 criteria. Number 1, irregular periods, infrequent periods, which are more than 35 days frequency, means occurring more than once in 35 days. It could be 2 months, 6 months, sometimes years. Some women don't get periods for years. or less than 8 cycles per year, let's put it like that. So this is called oligomenorrhea, that means lower number of periods. Now, the second criteria is higher levels of the male hormone. All women have the male hormone in their blood, but it's a very much lower than in the male. When this hormone is more than the normal, above the normal range in a woman, it is called hyperandrogenism, and it can give certain symptoms, physical characteristics like acne, oily skin. It can cause hair loss from the scalp, receding hairline like in males, or it can cause excessive hair growth over the face, chest, back, or buttocks. Not necessarily all of these places. So this is hyperandrogen. This is the second criteria for polycystic ovary syndrome to be diagnosed. And the third, it comes last in the list, which just shows it's probably the least important, is the imaging of polycystic ovaries, which means cysts in the ovaries. So 2 out of these 3 is all that is what is necessary to diagnose polycystic ovary syndrome. So you just the finding of polycystic ovaries on ultrasound does not mean you have polycystic ovary syndrome. This is why it is most commonly overdiagnosed. The moment you have regular periods, you have no signs of excessive testosterone in the blood, but someone happens to do an ultrasound. It could be a radiologist, a gynecologist, a general practitioner, and the moment they see cysts, small cysts on the ovary. Now you have to remember, we are not talking about cysts which are large, 3, 4, 5 centimeters. We are talking about cysts which are very tiny, 2 to 9 millimeters, which is less than 1 centimeter. Okay, the moment they see a few cysts in the ovary, they label them as PCOS. This is not right, and this is what leads to overdiagnosis and overtreatment. So we have to remember the criteria are at least 12 of these small cysts in either ovary, all of them less than 1 centimeter, and thirdly, they have a increased ovarian volume. The ovaries are bigger than 10 cc. So it's important to measure the volume of the ovary, not just visualize small cysts and label it as polycystic ovary syndrome, because then the whole treatment is diverted when it's not necessary. Treatment is started for polycystic ovary syndrome. So that's as far as the explanation of the diagnosis is concerned. What are the problems associated with polycystic ovary syndrome? Polycystic ovary syndrome is a very complex metabolic disease. It is actually one of the, or rather it's said it's the most common endocrine disorder in women of childbearing age. So you can imagine, it's not thyroid problems, it's not even pituitary problems, hyperprolactinemia, but it is PCOS, because this is a metabolic condition which can affect a lot of organs in the body, not just the ovaries, which is why I said polycystic ovary syndrome is probably a wrong name, a misnomer. So let's see what problems it can cause. It can cause diabetes, type 2 diabetes. If not at the time of diagnosis, it may cause later on in life. Women are more prone to have diabetes in later life. It can cause cardiovascular problems. It can cause obesity. It can cause sleep apnea, which is the problem where associated with snoring, when people actually stop breathing for a little while during their sleep and they keep waking up, and have poor quality sleep. So it's called sleep apnea syndrome. So this is associated with polycystic ovaries. And then of course you have the fatty liver, non-alcoholic fatty liver. You all must have heard of fatty liver, where the radiologist does an ultrasound and then they find there are fatty deposits in the liver. This is of course commonly associated with excess alcohol consumption, but non-alcoholic fatty liver is a problem with polycystic ovary syndrome. And then very importantly, depression. Depression is a very common symptom of polycystic ovaries, and it's underplayed and not given enough importance, but this is a very important symptom. You see, diagnosis, I told you, is clinical, but there are certain tests, not an excessive amount of hormonal tests, which are required for polycystic ovary syndrome. I've seen patients spending thousands of rupees on unnecessary hormonal tests, right from FSH, LH, estrogen, estradiol, progesterone, anything under the sun that anyone can think of, the woman is made to do. But basically we need 3 important tests. We need to check the testosterone level. There's something called free androgen index, and then possibly sex hormone binding globulin. But this is all technical. There are very few hormonal tests. The diagnosis is clinical. Of course, clinical includes ultrasound. That is what is important. And then also, what causes polycystic ovary syndrome? The fact that it's still a syndrome means that there is no identifiable cause yet, but it is seen that it runs in families, and they have not yet identified any genetic cause for it, and you tend to be born with it, but of course it becomes manifest when puberty takes place. Once the periods start, menarche, when periods start, then the irregularity of the periods is the first symptom that can come up. It's important to understand that there are different severities. There can be very mild PCOS and there can be severe PCOS. So mild PCOS, the periods may be once in 35 days. There may not be too much of hirsutism, that is excess hair growth, maybe just mild. And thirdly, the person may not be very obese. They may not even have polycystic ovary picture on ultrasound. So you can have very mild disease, and then you have the severe full-blown polycystic ovary syndrome, where it's a person who does not have periods at all for month after month, sometimes years, and then they are very obese, they have excessive hair growth, they're not able to get pregnant. So now, talking about infertility. So, okay, let's put it like this. A patient may come to a gynecologist for a number of one of these symptoms. They may be unable to get pregnant, which is infertility. They may come because of excessive hair growth. They may come because of not having periods regularly. So we try to address the problem we don't treat the syndrome. The syndrome is not curable. This is another thing, that the PCOS is not curable. It's there to stay throughout the life. Unfortunately, there is no cure for it, but we can manage the symptoms. So now, depending on the symptom, if the person has irregular periods, it's because of anovulation. The woman is not able to ovulate regularly. They may have sporadic ovulation, irregular ovulation, maybe 2-3 times a year spontaneously, which is why a lot of women with PCOS can conceive on their own without any specific treatment. So you have oligo ovulation, So if that is the case, and if they are unable to get pregnant, we will give specific treatment for them to ovulate, to kickstart or jumpstart the ovaries. If the problem is periods only, it can be a combination of symptoms. If it's period problem, we can treat it with hormones, modulate it with hormones, and until such a time as, let's say, another problem comes, which is, let's say, the woman now wants to plan a pregnancy, then we change the treatment. Okay. If it is hair growth which is a problem, there are medications which are available to reduce this, or there are certain procedures which a dermatologist can help with to remove hair growth, electrolysis, waxing, blah blah. And then mainstay of the treatment for anyone with PCOS, for those who are overweight, is weight reduction. Weight reduction is extremely important. We see commonly in clinical practice someone who has very irregular periods or no periods and is obese or overweight. The moment they start working on their weight, the diet, exercise is, let me remind you, there's a lot of talk about exercising to lose weight. Exercise is not going to make you lose weight very quickly. It's going to be very frustrating. I'm not saying you should not exercise. Exercise is to tone up your body, your muscles. But to lose weight, forget about it. You probably will have to exercise 4 hours a day, intense exercise, to really get a negative balance and lose weight. Diet is the way to go. The right kind of diet. I don't mean starving yourself, but eating the right kinds of food. A nutritionist is going to be able to. But what you need from your side is commitment to lose weight. You need to be committed if you want to really have a long-term solution to PCOS management. You've got to lose weight. You've got to be committed to it. I think we have covered everything. If you have any questions, you're most welcome to ask on the Facebook page, or you can come and see me at my clinic. Thank you very much.